Welcome to the December Commission on Aging meeting. Thanks to everybody for coming. We have a guest today, Joe Larchuk, and I'm sure I'm mispronouncing that name, but it's my best guess. He is the head, executive director of Post 53. I got an email from him a few minutes ago. He's running a little bit late, but he promises to be here, so we'll have him as our guest to talk about Post 53 and specifically focusing on emergency care for seniors. And perhaps he can give us some tips as to various things that we can do if we're ever in a certain circumstance where we have to call Post 53. So, this looks like, I've got a Post 53 sweater. There he is. Hey, Joe, how you doing?
I'm easy to spot.
There you are, absolutely. Thanks so much for coming, pick any spot you want. We're just, your timing is impeccable because we are going to just discuss our November minutes and then turn it over to you.
Very
Perfect. Good. So, Peter, I know you've got some changes to the November minutes.
I do, Joe. Mostly grammatical, but a couple of factual.
Sure.
Most relating to President Johnson's Older American Act wasn't established in the 1970s, it was in the 1960s. And that is where the 4 was put on Medicaid A. So it shows up here in the minutes as the 1980s. It wasn't, it was even longer ago than that, and $1,200 was established as a 4. So I'll just give this to you.
Yeah, perfect. I'll send it along to the secretary. Absolutely. Any other changes to November minutes? Hearing none. I have a motion to approve the November minutes as amended by Peter. So move second. Thank you. All in favor? I appreciate it. Now, Joe, we were guessing as to your pronunciation of your last name. Tell us how it goes.
Larchevêque.
Larchevêque, thank you. We were all off, actually. But in any event, Joe, it's great to have you here. Thanks for all you're doing for Post 53. And I'm turning the table over to you, and then we'll get to our Mather Center report and our Human Services report. And you can stay for the rest of our meeting if you'd like, or you can book, up to you.
Great. Well, thank you for having me. I apologize, I was a little late. Traffic was not very pleasant around this morning. But I'll tell you a little bit about Post 53. As most of you know, we're the town's 911 ambulance service. We are extremely unique and the only service in the country that relies and is run by high school kids. So we start off our program with middle schoolers basically coming right out of 8th grade, getting ready for high school. They take our first aid class. They spend a year learning the equipment, working with the crews. Their sophomore year starts with our EMT class, which basically runs the entire school year for them. It ends in mid-March. And once they pass the Connecticut State exam, which is pretty grueling, they work the ambulance their junior and senior years. And then off to college they go. We have now 86 high school volunteers at Post 53. We have 56 very dedicated adults who work hand in hand with the kids every single day and night. We staff 2 ambulances 24 hours a day and respond to right now about 1,900 calls a year. So very, very busy. But that said, they do an amazing job. I've been with Post since 2018 as the director, and it's been nothing short of just an amazing experience for me, and working with these kids and adults has been great. So other than doing 911 calls and responding to people's needs for help, we do a lot of public education in town. We do CPR classes, first aid classes, overdose awareness classes. We talk about fall prevention, and things to hopefully get people not to need our services as much. That's basically kind of where we came from. We were formed in 1970. John Bud Doble was our founder, who wanted to create an experience for kids back in that generation to show them what the effects of drugs and alcohol were in that period in our history. And it just sort of grew from a very small group in his basement of having one van that went out and sort of helped the police department on emergencies to taking over the ambulance service in the mid-70s and then going on from there. And that's basically kind of where POST comes from. Two things that I think, that we try to put forward that would be very, informational and kind of helpful to us is a program that we started several years ago, which is called the File of Life program. So I don't know if you've heard of it, but basically what it is a sheet, and I brought one for each of you, so you can have it and see it. But it is a medical information sheet that hangs right on your refrigerator. And if for any reason you're unable to communicate what's going on, what your medical history is, what medications and allergies you're on, it's going to be right here for us to see. And this is extremely helpful in allowing us to figure out what can we do to help you, what needs to be done, what medical history do you have. So we have started to really push to get these out. We're going to be at the Royal next month doing a handout of these. They're free. We're glad to pass them out to anybody who needs them. And again, it's a very helpful tool. Whenever we pass these out, we tell the person, bring them with you when you go to the doctor's office. Bring them with you whenever you're getting a checkup, because things change. Medication gets dropped, a new one comes in, something gets tweaked on your medical history, and keeping this up to date is extremely important.
Joe,
Yes,
I also keep one of those in our car.
that's outstanding. Yeah, great. Yeah, so we've found them in varying places, and it's great. But one of the things that when we're there at 2 in.the.morning, and we're asking these questions, if this information isn't readily available, it just kind of slows everything down. And we go to the hospital, and sometimes the emergency room doctor will be like, well, okay, what kind of medical history? Well, we don't know. And then they have to now sort of do some digging. So, to have this information is extremely important for any healthcare provider.
One of the things that prompted me to want you to come and speak to us was the do not resuscitate, which I guess would be part of this too. There was an article in the Times about a woman who suddenly woke up and had signed all the papers, but obviously no one knew. And I was just wondering how often you run into this, or is it an issue, or is it pretty readily knowledgeable?
It is an issue, and we do run into it quite often, where we will arrive at someone's home and be told, well, the person has a DNR, a do not resuscitate order, but it's not, nobody knows where it is, or it's not on the form it needs to be on. So Connecticut was actually very much ahead of the curve in the 1990s, and they were one of the first states to codify do not resuscitate statute. And since it was very early and sort of one of the forebearers in the country, it was extremely specific. And if you were the physician was going to grant you a DNR, you had to wear a specific bracelet that was only available from one vendor. And while it was sort of, advanced for its time, physicians weren't very well prepared on how to have that frank conversation with their patients about whether it's time to have this. A lot of people who wanted to have the bracelet, but were still somewhat mobile, maybe might go to church on Sundays or get out into the community, didn't want the stigma of having that bracelet on them, or having family come visit them at home and have that bracelet. So now there's 2 different forms that we can accept. We can accept basically any bracelet. The medical alert metal ones that you see out there have a do not resuscitate version of it. There is still that original Connecticut band that looks like one of the hospital bracelets you get when you go into the hospital. And then there's also something called a MOLST form, which is Medical Orders for Life-Sustaining Treatment form. And that is a document that the physician can fill out along with the patient that says, if I suffer the following emergencies, here's what I do and what I do not want done. The do not resuscitate bracelet and the orders prior to the most form were very specific to, if my heart stops, I don't want anything done. Up until that point, we have to do everything, right? So if we get to someone's home and they are barely breathing, or they are in a condition where, we can do some advanced procedures to help them. We were forced to do those, even though it was sort of close to the end that they had wanted to have that peace at home. The most form now allows for, if you find me in this condition, I don't want oxygen, or I don't want this done, I want that done. And it becomes sort of the patient's codified, wishes on paper. As long as that form is present and signed by both the physician and the patient, we can accept it.
So to follow up on that point, if you see a DNR bracelet, your high school students really can't honor that DNR bracelet because the what ifs.
So they
They can.
They can if the person is in cardiac arrest, their heart is stopped, and they are wearing the DNR bracelet.
Then you don't have to.
We don't, and actually it's not even that we don't have to do anything, we can't do anything.
Got it.
Because that would violate the patient's wishes.
Right.
The most form creates a little more flexibility for the patient to decide what they want to have done before they
Got it.
actually pass. And somebody might say, look, in the condition that I have, I'm gonna have, some tough days, and I'm gonna, maybe be in a condition that, my family might panic and want to bring me to the hospital for. And I don't want that. And here's exactly what I want to have done.
So a most form sounds like it gets to where these, again, it's amazing to me that high school students, right?
Mm-hmm.
With a most form, okay? And they're interpreting this most form on the fly,
Right.
right?
Right then and there.
Quite impressive. I mean, as far and a very heavy burden on them as well, would you say?
Mm-hmm.
In terms of, do I do anything for this person? But the most form says not to. In a gray area, do you tell them to go to fix and then take them to the hospital? I mean, there's got to be a gray area at some point on that most form when you
Right.
approach somebody in a home.
Right. So there always is some level
Yeah.
of gray. And, a lot of times what happens is, the immediate family is very comfortable with what's on the most form, but the call happens on a day when a niece or nephew is visiting, or there's no family around, and is this what the person truly wanted? And that sort of conflict goes on in their heads. If we have any concern, and look, sometimes the most form is very valid, and the person is comfortable with their decision when they sign it, but it wasn't supposed to happen this fast. So the family panics and wants something done. We really do try, and all of our members, adults and high school students, are trained to have that conversation with the family that when we're pushed against the wall, we will do what the family asks because they're the ones who are there.
Sure.
But we do try to explain to them kind of what the most form is, why it was put in place, and that these were truly the wishes that your mom, dad, grandparents wanted. But it can be. And one of the fallback positions that we always have is a physician available 24 hours. So we operate clinically under the guidance of emergency department physicians. And we can call them right on the phone and just say, look, this is exactly what we have. Here's what the family wants. Here's what the most form clearly says. It's signed, it's dated, it's accurate. And kind of where do you want us to go from here? And it's amazing. And again, they are, for the most part, high school kids, and EMTs in general will give advice. But boy, the minute that you say, a physician would like to speak to you on the phone, then I think that carries a lot more weight. And so a lot of times it's just a matter of a physician saying, look, here's kind of where your loved one wanted to be. Can we get her to that piece? And I think they get there. The family gets there as well.
So it's basically a principle of autonomy for your patient, right? So their autonomous wish not to have medical intervention, okay? But played against family members, especially as you mentioned, the classic niece or nephew visiting, who say, oh my God, we can't let grandma die like this.
Right. Right, exactly. That's exactly right. And that's why, I think over the years, since the do not resuscitate law has come about, there has been a push to get the general practicing physician, the family medicine physician to really engage their patients that, I'm gonna give you this form, or I'm gonna give you this bracelet, or, go pick it up at this location. It has to be more than that. It has to be, what to expect when that time comes. What does this actually mean? Who do you call? How do we kind of get you to the point where that event is as comfortable as can be for you and your family? And those are conversations that frankly physicians didn't have very early on with their patients, and I think now they're getting there. The biggest issue I started off with saying is a lot of times we arrive and it's just a form that came with a packet of other forms that was given a year ago, and that is filed away in a drawer somewhere. And the time to look for that is not the time that we're standing there in the bedroom, because then we are sort of required to start resuscitation care. My strong recommendation is when you agree and your family is all on board with it, know exactly where that form is, or have that bracelet on, whatever choice you choose to let us know. But we struggle sometimes. Again, it's a lot of it is some physicians who aren't fully aware, they'll write it on a prescription pad, or have it just be a note on a long piece of paper that's buried on the second page. Oh, by the way, patient request, do not resuscitate status. Those we can't honor. But as long as it's valid and the right steps have been done.
And your adult advisors are trained in all, what to look for.
Absolutely, and that's a great point. I failed to mention earlier. We do, these kids do an amazing job out there, but we have an adult advisor on every single call that responds with them. So there's always somebody, and they're not very clinically involved. Their job is to handle these sort of, making sure everything is set, making sure that the patient and the crew is safe, but to talk to the family, to look at the paperwork, just to validate that everything is in order. And move on. We also have a town paramedic. So there is a paramedics not directly affiliated with Post 53. They have a separate station over by the Royal, but they respond to all of these calls as well. They're really the ultimate decision maker when it comes to the clinical aspects of care. So they'll look at everything, determine whether it's valid, and we can stop. Because one of the things that happens, is if we respond and it is a cardiac arrest, and we're doing CPR, it's a lot of activity, and there's a lot of things going on, and honestly, it can look chaotic even though it isn't, and it's your loved one, and it's a lot, and then all of a sudden, off we go to the hospital, and there's an unknown until you get to the hospital to find out what the outcome is. And again, if the person gets resuscitated and gets a heartbeat back, and is now up in ICU, and it could be on a ventilator for a long period of time, it's not really what the person wanted. That's kind of what bore the whole DNR thing out. And now what we can do is we can say, what, we're going to make your loved one comfortable. We're going to put them in, leave them in bed. We're going to make them where it's have some comfort that this is exactly their home. This is where they want to spend their final moments. So as long as physicians continue to have conversations like that, and we get these DNR forms or bracelets out there, we're very well versed on how to deal with it.
Can I just ask you a question? How do you know where to go? Like, are you told to go to Stanford Hospital, for instance, or do you always go there?
We'll go to either Stanford or Norwalk. Those are our two primary hospitals. About 75% of our patients choose Stanford, 25 choose Norwalk.
And then you have a computer in the van
Mhm.
that's pretty sophisticated, I've heard. And so you can pull up sometimes the patient's records?
We can, so if they were ever a patient with us, we have access to that previous information. So, you know, a lot of times for the crew, it's just a matter of validating, are you still on these 3 or 4 medications? You know,
So that's in the computer?
so that's all in our computer.
But the physician, like, let's say it's part of Stanford Health Group, it's a big group.
Yeah, absolutely.
And that physician has given these instructions, you know, agreed with the patient.
Mhm.
Would that be in the computer? Probably not.
Probably not, right. So it would, yeah, so we would rely again on them having that
Is it
information.
hard to get a hold of the physician sometimes?
No, not for us. I mean, we
Oh, you
don't,
have a way to get.
right, but you know, we don't have the opportunity most times to speak to the patient's own physician. We're not calling them, you know, we call the emergency department physician. So many times they're as ignorant as we are of what the history is because, you know, so what they're going on is what we found, what we assess, what we have available to us, and then they're making a decision based on that information. So, you know, is it perfect? Is it, you know, telehealth today? No, but it's, you know, it's just an opportunity to have a real, you know, doctor-patient conversation, you know, beyond EMS at that point.
Throw one more gray area at you. You know the person is under hospice care. There are hospice people potentially there. Does that change the calculation at all?
It does, and, you know, one of the things that happens on hospice, and it depends on what their, I guess, you know, care plan is under hospice, is, you know, if they go to the hospital, a lot of times it jeopardizes sort of what their hospice situation is, so I know that, you know, we've had some issues where people have called and we bring them to the hospital and, you know, it causes some stress on the back end with their hospice plan. So, you know, when we find out that they're on home hospice, you know, we try, and the paramedics are very well versed in this, to have, you know, to have a conversation. Again, we don't never want to deny care, stop care, not provide care. We want to make people comfortable. But again, I think that really comes down to, you know, that frank conversation, and especially with the hospice team. And I'm sure they're, you know, they're very well versed with that. Now to come in, you know, when do you call 911? What is the conditions that meet that need? But yes, as you know, so I mean, when I first started on the ambulance decades and decades ago, there was one hospice center in all of Connecticut, in Branford. And, you know, that's where we would, you know, people would go. Before that, you know, there was no other alternative. And they opened other centers, and now there's home hospice, and, you know, so there's just a lot of things that go along with that to make sure that they continue to keep their hospice care in place, you know, once they call 911, once they get to the hospital.
Can post 53 provide any palliative care in those circumstances, or is that back to the person's personal physician?
Yeah, it's really back to their personal physician at that point. You know, once we arrive and we can kind of identify that, again, you know, our presence doesn't mean you have to go to the hospital. It is always patient choice, and if there is something that we can do within the scope of our care, provide some comfort, some oxygen, you know, bandage a wound if they fell, you know, they can always refuse to go to the hospital. We just get them to sign, and that's absolutely fine. But, you know, again, that often, you know, generates a call to the hospital just to say, you know, this is kind of where we are, what we found. Patient is a hospice patient, does not want to go to the hospital, and then we'll.
The fact that someone called you, though, means that it's not clear cut at the
Absolutely.
house, probably.
Absolutely. And it's incredibly scary. You know, it's scary when you have a loved one and they go on hospice care, and, you know, you're told, you know, sort of what to expect, but, you know, one night they develop some shortness of breath or, you know, other signs and symptoms that, you know, might lead you to think the end is near, and you don't want to see them suffer like that, so you panic and you call. You know, and like I said, you know, we're there to help, and, but ultimately our job is to bring people to the hospital, so, you know, we'll have some conversations and we'll get the physician and the paramedic involved. And then, you know, we'll decide what to do, what's in the best interest of the patient.
Just, I'm curious, are you seeing, like in the years that you've been with the Darien Post 53, are you seeing any trends year over year with like the number of calls, the types of call, the demographics of who the, you know, patients are?
Sure. You know, we certainly have seen an increase, especially post-COVID. Our call volume has increased every year. And falls are our most common, you know, especially
With elderly?
with elderly in our older population. So that sort of spurred us to, you know, go out there and try to talk to people about sort of fall-proofing their homes and doing some things to put them in the best position to prevent that from happening. You know, we have, you know, again, unfortunately, maybe a byproduct of COVID has been an, you know, increase in mental health related emergencies that we respond to as well. And, you know, the demographic has changed a little bit. You know, we have a lot of younger families that have moved in. But, you know, primarily, you know, falls and sort of, you know, general illness calls are our most common. Yes, sir.
I'm in your database, and I was curious, can I have that database updated? In other words, what brought you to our home some years ago, my medications have changed, for
Right.
example.
Right.
And related to that is, can somebody pre-register, somebody that lives in town?
That's a great question, and unfortunately, the way it's set up now, no, because what they will often bring up is the previous report from your, so there's no way to update that information without changing what was on the previous report, which was valid. So we, you know, they might just quickly, you know, ask you, are you on the following meds? What a lot of times they'll just do is get a fresh list. And then, you know, the report that's generated, you know, from today's event will have all of the updated information. But we don't, there's no current subscription practice to get people in there early. I'm actually intrigued by that. That's not a bad idea.
Yeah,
Talk to At Home in Darien.
That's right.
Great, Mike, or
great.
senior center.
Yeah.
But even these Mohs reports, it would be valuable to have more circulated.
Yes, you know, one of the things that we can do is there is an ability, and we've talked about this with the MOLS forms and other sort of important information to have, is put them in the dispatch computer system. So that way, when you call 911 and it comes up that you live at 123 Smith Street, there is an ability to have other information populate as well. You know, elderly person on the second floor, you know, patient has a DNR or MOLST form, you know, patient requires assistance on this. So that's called pre-arrival instructions, and those are extremely helpful to us because.
How would you do that?
Let me reach out and talk to our dispatch center. I know there are ways to get the information in there. If we can sort of figure out a way to gather it and then I can deliver it to them, that would be probably the way to go. But, you know, we have, you know, some people in town who have, you know, extensive medical histories or transplant patients, you know, that information gets readily shared. But it could be expanded in a much greater role just so we know when we're arriving. You know, a lot of times we might need some help with, you know, people who are, you know, too large for our crews to lift, you know, so if we know that in advance, we call the fire department to assist us.
Right.
So that information is valuable. I'm learning a lot today, this is good. Keep it coming.
But does the fire department show up with the 911 call anyway, or?
No, so not in Darien. So in the town of Darien, we have two EMS responders. The police department is our first responder. So they have cars throughout the town, 24 hours a day. So if you call 911 with an ambulance request, then they will send the closest police officer. And they are trained as emergency medical responders, which means that they can do very basic life-saving skills to sort of bridge the gap until the ambulance arrives. And then you have the Post 53 ambulance, which is staffed by EMTs 24 hours a day. And then you have the town paramedic. The town paramedic carries advanced procedures, 50 or 60 different medications that they can administer you. They can do EKGs, so they have a much greater breadth of knowledge and ability. And then, you know, if we go to a motor vehicle accident or there's a need for, you know, rescue service or the fire department, then they'll come as well.
Joe, I just want to add, because every time we call, the police usually come first. The
Right.
police are wonderful also with keeping everybody calm.
Yes.
Once they come, for me, crowd control. If something happens in an exercise room and I can't get people to either stop exercising or stop gawking, once the officer, they're not listening to me, they're gonna listen to the officer, which clears the way
Yes.
for you, which could happen in restaurants or stores. So you want your police to be there for those reasons
They are
as well.
extremely helpful.
For the, you know, for the actual interference of other people, that doesn't happen at your house. Well, you could have a relative that needs calming too, but, so the system here works beautifully.
Yes. No,
um,
and they, you know, one of the things that I truly appreciate about our police officers is, you know, and other systems that I've worked, you know, sometimes it's sort of, you know, isolated, you know, they get there, they do something, and then the ambulance arrives, and then they back off, and then the ambulance takes over. Here, we work as a team, so they're, you know, they're right there helping, they'll do anything that we ask, they're very good at getting information, and they're great at crowd control. And look, in the minute that the EMTs will take over, the officer backs away and gets information, and it really is a stellar system we have here.
Just another quick question, so I recall when my father was alive and living with me and I called, I think there were 2 times I called. I recall one time, I believe it was during the day and it was New Canaan that responded. Is that something that happens normally?
No, that'd be a very rare occurrence. So what happens is, if our 2 ambulances are already on calls,
Okay,
and a third call comes in, we have mutual aid agreements with all of our surrounding neighbors, so, you know, it tends to be Stamford EMS who will send an ambulance in to respond. Norwalk Hospital EMS will send it if it's on the east side of town. New Canaan comes in the least, and you,
I live on that end of town.
so you're up there. So
maybe
pretty
that's-
much, you know, like, you know, Northern Hoyt, you know, Stephen Mather Road North,
Yeah,
you know, they can come right down South Avenue.
right.
But, you know, it's just interesting, because I just looked at this statistic the other day, and so far this year, they've come in once for help us. You know, we also provide mutual aid to our partners as well, much more than we get. We were in Norwalk just last month 14 times. We were in Stanford 9 times. So we do provide, you know, backup services and we were in New Canaan twice last month. So, you know, you know, again, we are extremely blessed here, you know, because our program is, you know, well-staffed, and, you know, around the country, you hear stories of, you know, volunteer ambulance services having to close or greatly scale back their services and availability because of the lack of volunteers out there. You know, we have a very dedicated group of adults and a very dedicated group of young adults who, you know, put these ambulances into service every single day.
Any final questions? Hearing none, Joe, thanks so much.
My
That was
pleasure.
brilliant stuff. Learned an awful lot.
Yeah.
Really appreciate it.
And here, please,
Yeah, pass these out.
pass
Thank you.
those out.
You do a great job.
Thank you. And if there's anything else, any things you want to hear about, I'm happy to return at any time.
Great.
Joe, I just want to mention that great connection the town has, because at Home and Darien, president for several years was Nancy Hurley.
Yeah.
She was a great president for at Home and Darien, I know she's a great presence for it.
Absolutely.
Yeah.
No. She was the director just prior to me, and we talk all the time to this day. So she's wonderful. And you know, the other thing too, you talk about At Home Darien and, you know, person to person and the town's human services. I mean, we have amazing relationships here. And I work with Ally at, you know, every day where, you know, there's something that comes up, or we're, you know, on the mental health task force. You know, again, I think that, you know, to look from the outside in, and see how well that we work together in this town, it's a blessing.
I'm just wondering, I'm on the board, a few of us are on the board of At Home in Darien, and Chris is our director. Should we make these available to our constituents?
The more we can get out there, the better.
Well, one of the things I'm gonna say, Joe, and I'd love to connect after to talk about, I mean, given the similar demographics and members.
Mhm.
Moving forward, there are a number of things that we're gonna either start or resurrect. We had a home inspection program several years ago,
Right.
which stopped because we were using some firm in Norwalk, and we really wanna we probably have had 5 or 6 members who have fallen this year.
Mhm.
So we want to resurrect the home inspection program. Love to get your thoughts on that.
Yes.
Your event at the Royal. Royal is one of our biggest destinations for our transportation. In my last update, we just got a 12 passenger van that we are going to be using for events.
Mhm.
And, I don't know if you want that exclusive to the Royal, but if there was an interest in having us bring 10 people to that event you're gonna have at the Royal, then we would promote that and try to get
Okay.
people there. So just, again, love to talk to you separately on that.
Absolutely, and we are open to do this anywhere, and, so
Okay.
we're gonna try to do it at the Heights.
Joe comes to the center at least once a year
Yep.
and always
Okay.
gets a big crowd. And you can see he's already a wonderful presenter, but he's even
You gotta let me
better
know when
with
he
his
comes next time.
constituents.
Yeah.
Because he gets great
So-
questions and he's so patient.
Well, I work better when I have the stars behind me with the kids. They sell it for me. But no, we're happy to do it. And again, I think when we walk in and we see that there's slip rugs on the floor, and look, and one of the things that I'm sure you'll probably deal with is as folks get older and they want to hang, that's chances are they're in the home they've lived in, they've raised their kids in, the grandkids come visit. It's very hard to break free from that, and it's also very hard for them to want to change anything in it, right? So when you say to them, we gotta do something with these stairs or remove slip rug, we have one family in town. Elderly husband and wife, they had 6 cats, and very well loved and maintained, but that was the reason they fell at least 2 of the 3 times we went there. And it's like, the more that we can just get education out about how to better fall-proof their home, the safer they'll be.
Would you like to stay for the rest of the meeting, or you?
I'd be happy to stay.
Great,
if you don't
thanks so
mind.
much, Joe, we'd love to have it, that way you can catch up with Chris afterwards too.
Sure.
So we'll rock and roll. Great, thank you so much.
My pleasure.
Really appreciate it. Next item on the agenda, Beth, Mather Center report.
Well, I had a pre-meeting, we had a pretty busy month and many of the bigger entertainments were very, very well attended. We've got over 120 people coming today for the final holiday program. We already have the highlights and happenings out for next month because there's so many things that are happening next month that we want to bring people's attention to. We are going to be the place for the legislative breakfast this year. The executive director of the Southwest Area Agency on Aging reached out, so we will be having that program on January 23rd from 9 to 11 for legislators. They're expecting, we'll see, about 125 people to come. That same day, we're having the state comptroller, Sean Scanlon, coming to talk about the state prescription drug program. And the next day, Eversource is coming. So anybody who wants to ask Eversource questions about their electric bill, and this guy is very brave to be coming. He says, his topic is let's talk energy. But we were very lucky to be able to talk him into coming because there's so many people asking questions about that and wanting information. The January newsletter is a big, January program's a big balance between health and wellness lectures. I just want to always reach out and explain everything that gets done during the day. A lot of people are not aware of. They're the education programs that we have a relationship already with Joe. We have to keep repeating these educational programs because it's really important that newer people that come into town or people that just weren't worried about these things prior because they didn't have an incident or an issue to be worried about them, we repeat a lot. So we have lots of wonderful health and wellness programs, lots of things that are information and educational, because we want to keep people in their homes as well. That's our goal, is to keep people in the community as well. So just keep looking, and I think it's really important that people understand the newsletter is online at least 2 weeks before the month prior. And we give a constant contact every single week about upcoming week, so it's a shorter thing than the newsletter, to remind people. So, yeah, we have wonderful, wonderful resources and ongoing programs, varied for entertainment too, obviously, for a creative imagination. We did on the front of the January newsletter show, we have 14 exercise classes. All of our exercise classes are about not falling, because falling is the biggest issue from 60 and up. So people think it's just older folks. No, it starts that young. So the more that you can do things to keep yourself resilient and keep yourself as balanced as you possibly can throughout, and not rush and all that kind of thing. So we need that information constantly, because that really is the thing that in many cases keeps people from not being able to be independent and having to move into either long-term care, assisted living, that kind of thing. So I want to reiterate, that's our goal too. That's the goal of the Older Americans Act, of having this place that you can come and go, get service and information on the regular, constant. So happy, I can't believe this says 2025, quite frankly, that we're already going that way, but we're trying to get news word out, in advance. And in terms of participation, we just did the, I don't know if people listened to our first selectman's State of the State. We went up from 1,100 regular participants to Darien residents now, to close to 2,000 Darien residents.
Great.
And part of that is now, we do have a non-resident limit. And part of it also is we have had a lot of new people move in and have their relatives move in to the places that David's built. And they're coming to the center right off the bat. So we're very lucky to have At Home. We're extremely lucky to have our great human services and all of our services, because we all have a kind of a hand in keeping people healthy, well, and on their feet.
Questions for Beth? Hearing none. Human Services Report. Both Cynthia and Ally are getting training, I believe, today, so they couldn't make it, but I did get the report from Ally, so I'm just going to read it so you can pretend I'm her. I got the green glasses for it, so I'm ready for that. Holiday programs. We have had a total of 55 senior and 50 families adopted for the holiday season. We are extremely appreciative of the generosity of the donors. Darien Human Services holiday gift giving. With prices of food and energy continuing to rise, many Darien residents continue to feel the strain. During the holidays, Darien Human Services has an Amazon wish list, including gift cards as well as home good items that we give to our clients on a monthly basis throughout the year. There is a very long here link, which you can look at our minutes as far as where that is, but I'm sure you can also call the Human Services at 203-656-7328, and they'll be able to also tell you how to access that. Mental Health First Aid. The town of Darien is offering another chance to attend the Mental Health First Aid 8-hour interactive certification course. This course is designed to give members of the public key skills to help someone who is developing a mental health problem or experiencing a mental health crisis. Like CPR training helps a non-medical professional assist an individual following a heart attack, mental health first aid training helps an individual who doesn't have clinical training assist someone experiencing a mental health crisis. Dates are January 15th and January 16th, both days from 8:30 to 1 at EMS Post 53. Please register by emailing Ally Ramstock at her email address, aramstack@darienct.gov. This program is being funded by ARPA funds. Energy Assistance Program began on Monday, September 16th for customers who heat with oil, and on Tuesday, October 15th for customers who heat with electricity, gas, or propane. Income limits apply based upon household size. If you have one person in your house, it's $45,505. 2 people, $59,507. 3 people, $73,509. 4 people, $87,511. 5 people, $101,513. Medical Loan Closet continues to be a great resource for Darien residents for short-term loans of wheelchairs, knee scooters, walkers, crutches, and canes. A refundable deposit of $50, check payable to the town of Darien, is required for wheelchairs, transport chairs, and walkers with a seat. The feedback from residents is positive, and they appreciate the convenient resources. Once again, that's the Medical Loan Closet at the Human Resources Center. Last but not least, the staff of Darien Human Services maintains an emergency call list with the names of vulnerable seniors and individuals with disabilities to contact prior to and after a storm or townwide emergency. We called the list Monday in anticipation of Tuesday's storm. We now have close to 100 residents on our list. We are requesting that any individual is vulnerable or has medical conditions that might make them vulnerable during an emergency notify Darien Human Services, once again 203-656-7328, so that their name can be added to our list. Respectfully submitted, Ally. Great. I would take questions, but I couldn't answer them, so you'll have to wait till January on that. So moving on, old business. What you got for us, Peter? Anything?
I do several things. First of all, tax aid program, Simplify Connecticut, AARP. Darien Library is going to be involved again, 3 days probably. Just for those watching, there's no age limit on this, there's no income limit on this. It simply has to be a simple tax return. So it can be, if for example, if you're a day trader or you're using crypto coins, then no. Or if you're in an inventory business and you're keeping inventory in your house, or if you're in the rental business, no. But otherwise, simple, and again, you'll see the information coming out on that, both in Darien and in Stamford. The library is going to be open again on Saturdays during this time. Second of all, Beth mentioned it, and I think it probably, if you can, put it on your own calendar so you can come. On January the 23rd, SWACA, the Southwestern Connecticut Area on Aging, is having a legislative breakfast. We haven't done this for a number of years. It's going to be at 9 o'clock, and we're going to invite legislators. And for example, SWACA really has 5 issues that they really want to focus on. The first one, and the most important one, we've talked about this before, is increasing the Medicaid asset limit. But other things, increasing support for Medicaid providers, a community-based navigation system to help folks find resources, and then, of course, housing and utilities. So, I mean, our town of 23,000 people has 3 reps and 2 state senators. It has Tracy Mara, very important now because prescription drugs are going to be much more important. She's heading now a joint committee on prescription drugs, looking at lower income. She herself is a pharmacist, okay? We have Matt Blumenthal. Matt Blumenthal was probably the prime mover in getting absentee ballots and extended voting days. We have C.C. Mayer, who represents a whole swath of towns, a piece of which is ours. And she used to run person to person, so she's certainly connected to seniors. And then we have 2 state senators. We have Senator Billy Miller, who is important because she's very active chairing the Committee on Aging at the state, and Bob Duff, who's the Senate Majority Leader. So we want to get these people, and we want to kind of lay out what our needs are, and then have them talk about how they plan to address it. Okay? In parallel, AARP is arranging to meet with every state legislature in the state, and we have enough volunteers, we're going to probably do that. But I just wanted to, I had a brochure here. I just wanted to point out, here it is. So this is our legislative agenda for AARP. 2 important things. I don't know if anybody's seen on television, there's a lot more commercials these days for lending, payday lending. Well, our state has had very strong laws against this predatory, we call them predatory lending, but it's coming back. It's coming back. And so we know that's gonna be a fight that's gonna be developing, and we're certainly not gonna allow that to happen. Again, it may not affect us because so many of us are retired, but it certainly affects our caregivers, it certainly affects our family. So that's number one. The second thing is ARP in the state is going to make a push to support family caregivers. And the thought being, there are states in this country now where you can get financial tax relief by supporting, and we don't have it in Connecticut, but we're going to work on it. Because again, we have 420,000 unpaid family caregivers in this state, and they've provided last year an estimated 390 million hours of support. And for some of us, it may not be a problem because, again, our situation. But you know, there's so many times, I'll give you one really simple, quick example. I know somebody in this town that for more than 20 years worked out a deal with their employer that they could come home every day and take care of their aged parents till they died. I mean, providing insulin support. And this person worked it out with their employer, a great sacrifice, and it just happens, and it happens all the time. And there are many instances where they really could use some financial support. So that's, I know we're running out of time, so that's about where I'm gonna leave it. But the point is, you know these people, you see these people, Senator Duff, Senator Billy Miller, Matt Blumenthal, reach out to them and remind them I hope you voted for it, but if you didn't vote for it, tell them why you didn't vote for it. And get them to focus on our issues. There's a lot of things left on the table from the last legislation that we want to try and do, but it's going to be a very tough year financially, and it's going to be a very tough year with changing political climates.
No doubt. Peter, how does one register for the legislative breakfast on the 23rd? Do you know? Beth, is that you?
They didn't put the flyer out yet, but there's gonna be it's gonna go out, and I
Okay.
think they'll probably send it to everybody, and there's an RSVP.
Okay, cool.
Yeah,
Because that's, I mean, to the
Where's it gonna be
extent.
held?
at the Mather Center.
Oh, good.
Yeah.
It makes it easy.
Yes.
So let's
also
try to
gonna
get as many of us as we can get there.
Yeah.
I'll definitely make my every.
There's also going to be one in Fairfield the week before, and again, important because Senator Huang is now on the senior committee up in Hartford, so
Cool.
we're gonna,
I know you'll be there.
you know,
You'll be on the one on
I'll
the
be on
9th, and
the-
then the ones in February. Peter is our main contact for those on TV 79 for all things state legislature, so we're very blessed to have him. Other old business, Chris.
All right, very quickly, we have an aggressive agenda for the upcoming year, and I mentioned home inspections. There are a number of other things that we are going to try to start with in terms of expanded services. I mentioned the van. We have our first official van ride tonight
Nice.
to the high school concert,
Awesome.
and we're bringing seven people with us, and that's going to be fun. We have about 14 people that are going, and we've secured spots for them and everything, so that's great. I was fortunate enough to be invited to the depot the other night, a group called the Volunteens, and they made a bunch of cards and some gifts for the seniors, so our drivers and volunteers are delivering those, and we've had other groups. A lot of these things go on, and we probably don't communicate enough, but a lot of the things are going on, try to stay connected to the seniors. And importantly, we're starting the new year with a new board president. Debbie Parnon, who is assuming the role of our board president. She came in the office about a year and a half ago and started talking about volunteering, and as she's talking, I stopped listening about her volunteering and saying, wow, we gotta get her deeper involved.
Totally.
The board decided to move her into that role, so she's gonna hit the ground running, and with members like Marcia Clary and Sue Oki, who are also officers on the board, we're really excited about things coming up. And we've got two new board members also, Stephanie Riggio and Deidre McGovern, that are gonna be joining us. So very excited, and subsequent meetings, I'll give updates on some of these new programs.
Well, I know Debbie personally for a good 30 years, I think. It's certainly more than 20, and she is a firebrand. She's awesome. I mean, she's going to be great for that role.
Yeah.
That's a real nice coup for you guys.
Yeah, very
She's
excited.
great. Awesome. Cool. Other old business? Yes?
Just one little thing.
Yep.
We have, the ETC approved, interviewed Ms. Lewis, I think Jeanette Lewis, for the Human Services Commission.
Okay.
So I've been hounding the Board of Selectmen to get her interviewed.
Good.
It's not happening yet, there's 15 people to interview for commissions, but we need her, because
Yes.
we don't have a quorum on human services.
Right. Thank you for that update. Appreciate that.
And I should just report from the Blight Review Board that everybody saw, probably the news in the paper. We did recommend 2 properties to the selectmen for the town to begin foreclosure. Both of these have been vacant for some time. One has, a gentleman died and had no heirs, no will, and that is one that is being addressed. The other one, I think, may be resolved before it actually ever gets to foreclosure, but stay tuned. But in any case, we are actively trying to correct the issues that are being brought to our attention.
And Sue, I listened to that on TV 79, the last meeting. Nice job. And I also saw that there was a property that came off of the blight, and they had paid, I guess, the fees. Had that property been, it looked pretty good, the photo I saw. Had that sold and then they cleaned it all up? Do you know?
It was the one that paid the fees actually traded hands directly, and the town wasn't paid. There had been fees from previously,
Yeah.
and then it changed hands, and then the town let them know that this lien was still on the property and needed to be addressed, and that's the one that was paid.
Okay, and then it looks like they redid the house a little?
Exactly.
Yeah,
So
okay.
whoever had bought it, and it's currently on the market, actually.
Oh, nice job.
But, yeah, the town collected because it had been ignored in between.
Other old business? Any new business? Hearing none, I want to thank Joe again for coming to
Pleasure.
Course 53. Can I have a motion to adjourn this meeting? Thank you, second. Yes, thank you. All in favor? Aye. Believe it or not, see you in 2025.